Inspect and palpate the following on your partner. The medial epicondyle of the humerus and the medial supracondylar ridges of the humerus. Now, the lateral epicondyle of the humerus and the lateral supracondylar ridge of the humerus. Olecranon Process and Olecranon Fossa. Shaft of the ulna, shaft of the radius, the radial head, and the radial tuberosity. Inspect and palpate the following on your partner. Pronator Teres. The proximal attachment of Pronator Teres is the medial epicondyle of the humerus and coronoid process of ulna. The distal attachment is the middle of the lateral surface of the radius. Flexor Carpi Radialis. The proximal attachment of the Flexor Carpi Radialis is the medial epicondyle of the humerus. The distal attachment is the base of the second metacarpal bone. Palmaris Longus. The proximal attachment of Palmaris Longus is the medial epicondyle of the humerus, and the distal attachment is the distal half of the flexor retinaculum and palmar aponeuroses. Flexor Carpi Ulnaris. The Flexor Carpi Ulnaris has its proximal attachment at the humeral head, the medial epicondyle of the humerus, and the ulnar head at the olecranon and posterior border of the ulna. The distal attachment is the pisiform bone, the hook of the hamate bone, and the fifth metacarpal bone. Flexor Digitorum Superficialis. The proximal attachment is the humeral ulnar head, the medial epicondyle of the humerus, the ulnar collateral ligament and coronoid process of the ulna, and the radial head at the superior half of the anterior border of the radius. The distal attachment of the Flexor Digitorum Superficialis is bodies of the middle phalanges of the medial 4 digits. Brachioradialis. The proximal attachment of the brachioradialis is the proximal 2/3 of the lateral supracondylar ridge of the humerus, and the distal attachment is the lateral surface of the distal end of the radius. Extensor Carpi Radialis Longus. The proximal attachment is the lateral supracondylar ridge of the humerus, and the distal attachment is the base of the second metacarpal bone. Extensor Carpi Radialis Brevis. The proximal attachment is the lateral epicondyle of the humerus, and the distal attachment is the base of the third metacarpal bone. Extensor Carpi Ulnaris. The proximal attachment is the lateral epicondyle of the humerus and the posterior border of the ulna. The distal attachment is the base of the fifth metacarpal bone. Instruct your partner in demonstrating the active range of motion of the following motions at the elbow joint. Flexion. Ask the patient to bring their hands up towards their shoulders. Extension. Ask the patient to straighten out their arm. Pronation. Ask the patient to face their palms toward the ground. Supination. Ask the patient to turn their palms up towards the ceiling. Instruct your partner in demonstrating the following passive ranges of motion at the elbow joint. Flexion. Extension. Pronation. Supination.